So today's topic is vitamin-like substances. Those who have the textbook, it's page number 411, chapter 22, page number 411. If you have the new edition, page number may slightly vary. You can put the new page numbers in the chat box. If anyone is joining late, please help them out with the page numbers or topic name. So the new page number is 416. Those who have the recent textbook. So first, vitamin-like substances, they behave like vitamins. Okay. Vitamins don't have any calories. Okay, they are micronutrients, they are organic in nature. What do you mean by organic and inorganic? Does anyone remember the basic chemistry? What do you mean by organic and inorganic? What is the difference between these two? Basic difference. Yes, it is the presence of carbon. Organic, all organic compounds, they have carbon. Inorganic means minerals. Minerals don't have carbon. Minerals are like iron, some metals, okay, zinc. They have their own structure without carbon. Organic and any and every substance that has carbon in it becomes organic. So vitamins are organic micronutrients. Okay. Some compounds, they also have carbon. Why they are called vitamin like substances? They also have carbon, but they are not classified as vitamins. Okay, because uh, these items may be in animal products or plant products in much larger quantities than vitamins. Okay, vitamins are also present in animals and plants. Okay, in as a form of our human diet. Vitamins are present in plants and animals, but not to an extent, not to that extent how these vitamin-like substances are present in plants or animals. Okay, and they may not have some um, catalytic action as well. So that is also the reason why they are not considered as vitamins, but they behave like vitamins. Okay. And these substances are not essential for healthy individuals, those who do not have any disease conditions, those who do not have any deficiencies. Okay, people who are considered healthy, health as a definition of definition given by World Health Organization, it's the complete state of physical, mental, and social well-being as well as emotional well-being, and not just having a deformity, or deformity makes you unhealthy. No, people who are specially abled, differently abled, are also considered healthy as long as they are physically, mentally, socially, and emotionally good. Okay, so healthy individuals, uh, to an extent, some of these vitamin like substances that we will discuss, to an extent, healthy individuals can synthesize these substances within their own body. They don't require additional dosage of vitamin like substances from their diet. Okay, so first one is choline. Choline is a vital nutrient, but its consumption level can fall below the recommended intake if you are a vegan, okay, or you are a strict vegetarian. You are following specific type of diets. Okay, in such situation, what happens? Your choline content, or the way how your body synthesizes choline on its own, will fall way below the recommended values. Okay, and it is a recently discovered nutrient. Since 1998, choline was discovered. Although your body, healthy individual's body, can make some, you will still get some choline from your diet. And it is better to have some levels of choline from your diet to avoid any deficiencies. And your liver is able to make small amounts of choline, but majorly the major content of choline should come from your diet. Okay, it is an organic, it is a water soluble component as well. And some scientists believe that it should be grouped as a vitamin B complex, because choline, the way how choline acts is very similar to other vitamin B complexes. Okay, but so far it is not been it is not given the distinction of vitamin B complex, but it acts similar to vitamin B complex. And choline can have an impact over your liver function, healthy brain development, muscle movement, your nervous system, your metabolism. So adequate amount of choline is required. So it's a very structural component of all cell membranes. Okay, and it also helps in the transportation of and metabolism of fat and cholesterol. So this is one of the reason why um, it could be used as a fat burner, or it can be marketed as a fat burner, but to an extent. Okay, uh, you can't just take choline supplements just to reduce your weight. It does not function like that. Okay, it has one of its function to transport fat, so that it does not fat or cholesterol does not get deposited in your blood vessels. Okay, to prevent that, transportation and mobility of the fat is required. Metabolism, breakdown of the fat is required. Why breakdown of the fat? Choline helps your liver to function well. When your liver functions well, it can make bile salts, bile juice. Okay, and bile juice will further metabolize, will break down the big fat globules into smaller fat globules. Okay, it will emulsify the fat. So that's how choline will help in fat metabolism and transport. It also helps to make some neurotransmitters like acetylcholine, and it also helps to maintain the normal levels of homocysteine in blood. If the homocysteine is a protein that is found in blood, if the homocysteine level goes beyond normal, goes more than normal, it will start to break down your red blood cells. Okay, your RBC, red blood cells, will break down. Homocysteine will break down your red blood cells, and you will become anemic. So, to maintain the normal level of homocysteine in blood, the choline is required. Okay, for men, 550 mg, for women, 425 mg is the recommendation, daily recommendation. The best sources of choline is all your non-vegetarian food, red meat as well, one large egg, meat, poultry, okay, red meat, seafood, especially scallops. They also have good amount of choline. Choline can be made in your body, but it is in very small amount, not enough to support a good health. Therefore, it should be consumed through diet. And vegetarians, strict vegetarians and vegans, they who do not consume milk, eggs, or any form of non-vegetarian food, they are the ones who will have to focus on choline supplementation. So choline deficiencies, it could since choline is required for your liver health, brain development, neurotransmitter synthesis. Okay, if there is a deficiency of choline, all these systems will be affected. Your liver health, your muscles, your brain health, your memory. Okay, these things will be affected. And during pregnancy, if the mother does not have enough choline supplementation in her diet, it can also lead to neural tube defects. Okay, neural tube defects like cleft lip, spina bifida. Okay, what other vitamin is required during pregnancy to prevent neural tube defects, do you remember? Which is the other main vitamin which you should not go into a state of deficiency during pregnancy. Otherwise, it will lead to neural tube defects like cleft lip, cleft palate, spina bifida, anencephaly, microcephaly. Yes, folic acid. And what is folic acid? It's a vitamin B complex. Now you know the comparison, the similarity between choline and vitamin B complex. Okay. Postmenopausal women, pregnant women, women who are lactating, breastfeeding, children who have cystic fibrosis. Cystic fibrosis is a lung disorder. Okay, a child who suffers from cystic fibrosis produces a whole lot of mucus in their lungs. Okay, they cannot be physically active because their lungs will give up. They will always require oxygen supply wherever they go. That is cystic fibrosis. People, athletes, infants. Okay, choline consumption should be given a special attention if you come into this category. And also it can, to some extent, not much, to some extent, choline can elevate your endurance performance if you are an athlete. Okay, or if you work out in the gym. Okay, if you have enough amount of choline in your system, your muscles will not give up so easily. Okay, because it is producing you are producing a lot of acetylcholine that will give you more resources to make energy. So your endurance, you can push your endurance a little more further with choline supplementation. Best sources is eggs and all organ meats, fish, seafood, scallops. Whole grains have choline, but not to an extent to which it can support your requirement. Is it clear to all about choline? Next is L-carnitine or carnitine. Okay. It was discovered by the year 1950s. It was discovered in the year 1950, and it also has a very important role in human metabolism, especially fat metabolism. Okay, that's the reason why L-carnitine is a supplement that is notoriously known for fat burning. But so far, vegetarian source of choline is whole grains and cereals, but it's just a source. It's not a good source. It's neither a best source. It's just a source. It has some amounts of choline, but not enough to satisfy the human requirement, human body requirement. Okay. So L-carnitine. So this is a chemical that is made, that your own body can also produce. Okay, carnitine is synthesized in your own body. Your human brain, liver, kidneys, okay, they can produce this chemical. It is helping the body to turn fat into energy. So this was the main role of carnitine, which put it into the marketing of fat burning supplement. Okay, it is important for your heart and brain to function well, for your muscle movement, because when you convert fat into energy, you can move your muscles more, you can work out a little bit more, okay, without getting fatigued. And many other body processes, L-carnitine is required. So some people who suffer from heart disease, blood vessel disease like varicose veins or atherosclerosis, okay, they also use L-carnitine supplement so that the fat that is deposited in these blood vessels can be used up. Okay, some serious kidney diseases. Okay, but so far we do not have enough. There are some studies, but these studies are not enough to make a solid conclusion. We have not done an extensive study on L-carnitine. Some studies here and there it is done, but it's not enough to justify L-carnitine supplementation, okay, for fat burning, for heart health, okay. So sufficient amount of carnitine is critical for fat metabolism, sufficient because it is essential to transport long chain fatty acid from cell cytoplasm. Cell cytoplasm is the cell body. You have a nucleus, there is a cell that you have. Inside there is a nucleus and surrounding area is a cytoplasm. So long chain fatty acids that your cells have taken in, that is in the cytoplasm, it has to go into the mitochondria. Okay, and mitochondria will burn up these fatty acids and give you energy. Okay, so the movement of, if the long chain fatty acids are stuck in cell cytoplasm, mitochondria will not have resources to produce energy. So what happens? You are getting more and more fat deposits. You are getting fatter and fatter, but you do not have energy. You are always fatigued. You are always tired. Okay, but you have enough fat resources in your body, but you're not able to use it. Why? You do not have sufficient amount of carnitine in your body. Okay. So it will assist the breakdown of energy stores in cells, essential role in making fat available for muscle tissue for energy, promoting muscle energy so that your endurance, you can perform a little bit more. Okay. And carnitine always uses the long chain fatty acids that are present in your body to break it down for energy. It also supports a healthy environment for your lean muscles to grow, develop. So that gives you a more leaner and a defined physique. Okay. But it will not happen. Always remember, this will not happen if you just sit. You have a very sedentary lifestyle, you're popping in L-carnitine pills, and you expect to get leaner and have a defined physics. It doesn't work like that. Okay, your muscles have to move. Okay, to make the fat come, because when the muscle is moving, when you are moving your muscles, what is the first source of energy? Is it fat or is it glucose? When you're doing some physical exercise, what is the first source of energy? What will you burn first? Is it the glucose or the fat? It's the glucose. Okay, glucose is your primary source of energy. So until and unless you get rid of the extra glucose that you have in your body by burning it out, by being physically active, how will your muscles tend towards fats that are in your body for the second source of energy? Okay, first you go for a run or you walk, glucose in your body will be utilized up first and foremost. Then the body knows that it is still working out, it is still doing some physical activity, we need more energy, let's break down fats. We are depleted glucose, now let's move on to fat. Okay, so this is how the body functions. So if you are having a sedentary lifestyle, okay, you do not move around, your glucose is not getting utilized, the muscles will not you touch the fat until the glucose is depleted. Is it clear to all how carnitine functions as a weight loss supplement? You have to move, you have to be physically active. Otherwise, carnitine will not work. Okay. Is it clear to all? Some patients who suffer from chest pain are also given the supplementation of L-carnitine, so that they can exercise a bit more. Their exercise tolerance can be pushed a little bit more, along with some other standard treatment like people who suffer from angina pectoris. Okay, along with the standard painkillers and standard healthy heart medications that they have, L-carnitine can be given along with that to reduce the chest pain, to improve their exercise ability. Congestive heart failure, in this condition also L-carnitine supplements are given along with its major medications. Along with that, L-carnitine as a supplementation can be given. People who suffer from high levels of cholesterol, to take down the long chain fatty acid in their blood, L-carnitine can be prescribed. Kidney failure, but only by a physician or a doctor can prescribe this. Okay, doses and everything we cannot share that here because it depends upon the person's physical health, what disease they're going through, and only a physician can prescribe it. Otherwise, L-carnitine regular supplementation, just like your calcium supplementation, magnesium, multivitamins, L-carnitine supplements over the counter, it is available. Just look for FSSAI approved, ISO approved supplementation brands that produce L-carnitine supplementation. You can go with that. Okay. And they have written just one tablet a day or maximum 2 tablets a day. The packaging will have it. Okay, the packaging will have the details, or as per your nutritionist or as per the physician, consult your physician first also. Okay. Regarding chest pain and atherosclerosis, it is completely you are not, L-carnitine is not responsible to bring down the chest pain. It can only assist the people who suffer from chest pain to exercise more. Okay, we are not using L-carnitine here to reduce the chest pain. We are using L-carnitine here to help the patient who suffer from chest pain, who can't exercise a lot. Okay, because they get tired, they get fatigued, they get exhausted with a little bit of physical activity, just to push their endurance a little bit without giving them a physical collapse. L-carnitine is prescribed. Okay. So food sources, best sources of L-carnitine is again all your milk products, your red meat, lean meat. Okay, red meats, all forms of red meats have higher content of carnitine. And always remember, even if it is the fish, the more darker is a fish. Okay, can you name some examples of fish whose flesh is quite dark in color as compared to other fishes? The more darker is the fish or the flesh of red meat is also darker in color as compared to poultry. Kingfish, kingfish is a dark fish. Okay. Sardines are also slightly, they are not white, they are on the darker side, the flesh. Okay. L-carnitine is helping the fatty acids to break down. When the fatty acids break down, it can be used up by the muscles for energy. Okay, only when the glucose is used up. First the glucose has to be used up, then it will go for the fat. Okay, fat metabolism. So when you are getting physically active in the first half an hour, or even if you're on a low carb diet, within the first 15 minutes, your glycogen levels will be depleted. The muscle glycogen, the muscle store glycogen, that will be depleted. But you still have to work, you still have to be physically active, you have to get the energy. From where will you get the energy? From the fats that L-carnitine has broken down, help to break it down and supply you with energy. Is it clear to all? Kingfish, that we call as surma, is a dark fish. Okay. Beef, mutton, pork, they have darker flesh. Okay, so the darker the flesh is of any non-vegetarian source, the more is the amount of carnitine present in them. Okay. Mutton is not a lean meat. Mutton comes under red meat. Before workout, if you're taking L-carnitine supplement, take it before workout. So next is coenzyme Q10. Coenzyme Q10. It has different names as well, like ubiquinone. And structurally, it is very similar to vitamin K and vitamin E. So coenzyme Q10 is a molecule used by human body during aerobic cellular respiration. That is when your body or when your cells use oxygen for burning to give energy, to break down the ATP and give energy. When oxygen is used, that is aerobic cellular respiration. Okay, so during that time, coenzyme Q10 is used during the aerobic cellular respiration. Okay, when you are working out, okay, when you have just now started to run, when you just now started to walk, for the first 15 to half an hour, your body will be in an aerobic cellular respiration. Okay, if you are a beginner in workout, if you're a beginner in workout, maximum for 1 hour, your body will be in aerobic cellular respiration. After that, your body goes into an anaerobic pathway of burning the energy. That is when lactic acid pathway is used. Lactic acid is formed in your muscles to give energy. Lactic acid is a byproduct. Okay, and then after 2 days or the next day, you feel soreness in your body. Okay, when you have recently started to work out or use the gym, you have soreness in your body. That's because of lactic acid that has been produced because your body was undergoing anaerobic cellular respiration. Okay, so the first step is aerobic cellular respiration because you have enough oxygen. Okay, your body is capable of storing a specific amount of oxygen. Okay, with more endurance, with more physical exertion, the more muscles that you build, the more lean muscles that you build, more will be your capacity to hold more oxygen. So your aerobic cellular respiration will go longer and longer when you increase the intensity of your exercise, endurance of the exercise. Okay, week after week, it takes time, but week after week, as you develop more muscles, the oxygen holding capacity of your muscles will also be increased. Okay, so when the body is undergoing the aerobic cellular respiration, or coenzyme Q10, ubiquinone is used. And it is a nutrient that naturally occurs in your body as well. It is also found in a lot of food that you eat. It also acts as an antioxidant. That's the reason why it acts like vitamin K, vitamin E. They are also antioxidants by nature, these vitamins. And it will protect your cells from damage, and it plays a very important part in your metabolism. Okay. So the ubiquinone does much of its work in the mitochondria of your cells. Okay, this is where cell energy is produced in the mitochondria, that everyone knows. Okay, it works as an antioxidant as well, and it is the most fat soluble antioxidant. So it protects the areas with fats. Like when you have uh, coenzyme Q10 in your diet or by supplementation, you can be sure of that your blood vessels will not be damaged by free radicals. Anyhow, your body will produce free radicals. If you're breathing, if your body is using oxygen, free radicals will be produced. Okay, and free radicals do not know what to harm, what not to harm. It will harm anything in its way. Okay, free radicals will harm anything in its way. Okay, it doesn't matter if it is a blood vessels, heart muscles, regular cells, endothelial cell, epithelial cell, does not matter. Wherever free radical will reach, it will cause damage. Okay, so we have only very few fat soluble antioxidants in our diet. Okay, which is required because when ubiquinone when ubiquinone is taken, it goes wherever fat is. Okay, it will be there wherever fat is. The lining of your blood vessels from the inside also has fat. Okay, it has a fat. Your blood vessels have a fat lining inside itself. Okay, and when this antioxidants attaches itself to this fat lining, okay, that is within your blood vessels. As soon as a free radical comes to attack the cells of the blood vessels, the antioxidants will start working. Okay, it will give up its electron, it will calm down the free radical, and the free radical will be taken away from your body. Okay, so that's how ubiquinone works in your body. Healthy people, again, healthy people have enough ubiquinone in their body. They can produce enough ubiquinone. It can lower the blood pressure also. So heart patients, ubiquinone is usually used among cardiac patients. And it is found in all your major organs like heart, kidneys, liver, where it majorly functions as an energy transfer molecule. So if you are deficient in coenzyme Q10, there are high chances that you will develop some coronary artery disease. So if you have coronary artery disease or cardiovascular disease in your family, you have to focus on ubiquinone supplementation in your diet. Okay, so that you can prevent the damage to your blood vessels before it happens, because you are already genetically, you are on the risk of developing cardiovascular disease. Okay, people who are under immunosuppressing medication, who are suffering from any neurodegenerative diseases like Alzheimer's, Parkinson's, multiple sclerosis. Okay, people who are suffering from these disease conditions, it's better they also take coenzyme Q10 so that they can prolong their health as much as possible. So the best food sources of coenzyme Q10 ubiquinone is, again, all your meats, red meats, fish, nuts, some oils. Very less amount is found in vegetables, fruits, and cereals. Not enough for human consumption to meet the recommendation, daily recommendation for human consumption. And the type of the amount of ubiquinone you get from your diet is largely not enough to meet your body's requirements, especially if you have a history of coronary heart disease in your family. Okay. Some vegan sources that have ubiquinone, but not to the um, best of the value, is avocados, olive oils, cauliflower. All the nuts and seeds have ubiquinone to an extent, but not enough to meet your recommendations. And also people who suffer from migraines and migraine type headache, you can start ubiquinone supplementation as well, but it will take a lot of month and lot of time to work to show its effectiveness. Heart health, brain health, fertility. 50 microgram 50 mg to 1000 mg could be the range of ubiquinone supplementation that you can take, but depends if you're going for higher doses. If you're going for more than 400 mg and all, you have to consult with your clinician. But the standard dose of ubiquinone supplements, not medication, ubiquinone supplements usually range between 50 mg to 500 mg per day. The highest you can go is 1200 mg, but to go till the highest you will require the consultation of a physician. There are not conclusive studies regarding fertility, but some studies show that it can improve the sperm activity and concentration in men, but no, it is not increasing the cell count. Highest dosage of ubiquinone is 1200 milligrams. 1200 milligrams is the highest dose. But usually if you are doing supplementation over the counter, keep your dose below 500 milligrams. Is it clear to all? Next is lipoic acid or alpha lipoic acid. Both are the same thing. So this is the kind of your essential fatty acid. It works like an antioxidant. It is also made naturally in your body, found in major food sources as well. And usually it is used to break down your carbohydrates to give you energy. Okay. It is an organosulfur compound. It is organic in nature and it has a sulfur. Okay. It has a sulfur ion in its chemical structure. And it is extremely important cofactor in many enzyme complexes to form a lot of enzymes in your body. It assists in anti-inflammatory response. So it is anti-inflammatory in nature. It is an antioxidant. It is anti-inflammatory in nature. And it plays a major role in energy pathways, that is to break down carbohydrates and give you energy. It is both fat and water soluble. And people usually who are diabetic, they use alpha lipoic acid supplementation to ease their nerve pain. Okay, neuropathy, if the neuropathy has set in for diabetic patients, okay, to ease their nerve pain, alpha lipoic acid is used. It's also used to treat obesity, aging, to reduce the aging of your skin. People who suffer from high levels of cholesterol and they have other fats in their blood, to reduce that. Again, but we do not have any strong evidence that alpha lipoic acid can cure all these diseases, but it can have a positive impact on your overall health. Small amounts of alpha lipoic acid is definitely produced in human body. And weight reduction, it does not give you a major weight reduction, only a slight weight reduction. Okay. Weight loss, only slight, not that much. It can slightly reduce your body weight in adults who are overweight, but not obese. It can limit your brain cell degeneration because it is anti-inflammatory in nature. It has an antioxidant property as well. So it will reduce the inflammation or any free radical damage in your brain cells. So it can limit the brain cell degeneration, maintains the heart health or any muscle health. It can reduce the cholesterol level in your blood. So automatically it helps with your heart health. It benefits with NEM stress response. That's a neuro stress response. Food that contains lipoic acid, alpha lipoic acid. Organ meat like liver, kidneys, heart. Organ meats are good sources, best sources of lipoic acid. In vegetable, plant sources, broccoli, spinach, sprouted, any legumes or pulses that are sprouted, germinated, peas, tomatoes, carrots, they also contain alpha lipoic acid. All inflammatory diseases can benefit from, if you want to benefit from, or you want to reduce the signs and symptoms of your inflammatory diseases, lipoic acid can benefit you. NEM stands for neuroendometabolic stress response. So this is your adrenal gland. Okay, whenever you are stressed, your adrenal gland secrete a lot of epinephrine and norepinephrine. Okay, the body's ability to handle stress. Okay, so when your adrenal gland becomes dysfunctional, or they are not functioning well, they suffer from cancer, or they have some inflammatory conditions, okay, they will not produce enough amount of hormones for you to manage your stress well. Okay, so that is NEM response. Here your endometabolic. Okay, so your nervous system, your neurology, your endocrine gland, that is your adrenal gland, endocrine gland, and metabolic. Okay, metabolism, the way how food helps with the health of these gland, the health of your nervous system. Okay, all these three areas combined, it gives you a stress response. If any of these areas are dysfunctional, your stress response will also be down. Your body cannot handle stress. Is it clear to all? No, it does not have, in cosmetic, it does not have any benefit. It has to work from within. Alpha lipoic acid has to work from within because it's an antioxidant. It has to work from within. Then we have inositol. So it is an alcohol component, okay? Again, to an extent, it can be produced in your body as well. It became famous because for your PCOD, okay, women's health, women who are suffering from PCOD, PCOS, okay, for them, inositol became quite a well-known name in female reproductive health. So it's kind of a sugar alcohol made in the body, found in food as well, and it comes in various forms. It can help with some mental conditions as well, panic disorder, depression, OCD, obsessive compulsive disorder. It can help your insulin to work better. So with your PCOD, people who have PCOS, risk for preterm birth, insomnia, bipolar disease, okay, and many other conditions. There are no good scientific support yet, but still a lot of brands and lot of pharmaceuticals are using inositol for PCOD health. It's found in a lot of food like cantaloupe, that is muskmelon, oranges, brown rice, organ meat like liver, green leafy vegetables, but in very small quantity. Myo-inositol is a form of inositol that is most commonly used. There are 9 different forms of inositol. Myo-inositol is the most common one that is used in supplementation. So in recent years, possibly the inositol, possible, it's not sure yet. We do not know for sure, but possibly a lot of science and studies say that it is associated with improvement in a lot of disorders like high cholesterol, schizophrenia, psoriasis, ADHD, polycystic ovarian syndrome, insulin resistance, blood pressure, fertility issues in women, diabetes during pregnancy, that is gestational diabetes. Okay, so you can take, people who are pregnant, women who are pregnant, they can take inositol along with folic acid orally if you're pregnant, to lower your risk of preterm birth. And women who are suffering from gestational diabetes, they can also take the inositol supplementation. Oral supplementation of inositol is the most common way used. Anything that, when it comes to female reproductive disorders, anything that can control your blood glucose levels, that can treat your insulin resistance, will definitely positively impact your signs and symptoms which comes through polycystic ovarian syndrome. So that's about inositol. Is it clear to all?